This is All India Radio. We now bring you a special news program on COVID-19. Good morning, I'm Sunil Verma and with me is Subhadra Ramachandran. The headlines. New set of guidelines released to ease hardships during extended lockdown. Health Minister asks WHO officials to work with Indian counterparts to eradicate COVID-19 menace. Monetary policy measures taken by India helped defreeze market and catalyze credit flows, says Finance Minister Nirmala Sitharaman. Central Board of Direct Taxes issues over 10 lakh refunds worth 4,250 crore rupees in a week. IMF lauds India's proactive decision of imposing nationwide lockdown in its fight against coronavirus. The centre has notified a new set of guidelines in light of the extension of the nationwide lockdown till 3rd of May, in order to mitigate the hardship for the public and relax provisions for the daily wage workers and farmers. Selected additional activities have been allowed. These will come into effect from 20th of April in the areas which are not declared as containment zones. The government has stated that all agricultural and horticultural activities, including farming operations and farm workers in field, agencies engaged in procurement of agricultural products, mandis operated by the Agriculture Produce Market Committee, shops of agriculture machinery will remain fully functional during this time. Movement of all trucks and other goods carrier vehicles with 2 drivers and 1 helper, subject to the driver carrying a valid driving license, to remain functional. In addition, all finance-related institutions and health-related services will remain fully functional. The government has stated that all facilities in the supply chain of essential goods should be allowed to operate. MG Narega works would be allowed with strict implementation of social distancing norms and face masks. Operations of oil and gas sector, including refining, transportation, distribution, storage and retailing of products like petrol, diesel, kerosene, CNG, LPG, PNG, is also to be allowed. Hotels, homestays, lodges and motels which are accommodating tourists and persons stranded due to lockdown, medical and emergency staff, air and sea crew shall remain in operation. Government has also stated that all offices of the Government of India will remain open and police, home guards, civil defence, fire and emergency services, disaster management, prisons and municipal services with function without any restrictions. All other departments of state and UT governments shall work with restricted staff.
Revised guidelines issued by the centre to be followed in the second phase of lockdown have come into effect from yesterday. It has allowed certain relaxations in the notified services from 20th April in areas without hotspots. A series of directives have been put in place to ensure a strict compliance of lockdown. Our correspondent takes a look at the series of directives issued to ensure a strict compliance of lockdown in office and other establishments.
As per the guidelines, print and electronic media, including broadcasting, DTH and cable services, has been allowed. Data and call centers will be allowed for government activities only. Government-approved common service centers will be allowed at Gram Panchayat level. E-commerce companies have been permitted to operate. Vehicles used by e-commerce operators can apply with necessary permissions. Courier services, cold storage, private security services, hotels accommodating people stranded due to lockdown have been allowed to operate. Service provided by self-employed persons has been allowed, like electricians, IT repairs, plumbers, motor mechanics and carpenters. Anupam Mishra, AR News, Delhi.
Health and Family Welfare Minister Dr. Harshvardhan held an interactive session through video conferencing yesterday with senior officials and field officers of the World Health Organization WHO on the measures being taken for containment of COVID-19 in India. Exhorting the WHO officials, Dr. Harshvardhan said, "We have to work together to eradicate this virus as we eradicated polio and smallpox earlier. He said WHO is an important partner in our fight against COVID-19 and India really value guidance and contributions made by WHO in containing the spread of COVID-19 across the country. Dr. Harshvardhan said that India was first to respond to COVID-19 and stands on a better footing than the rest of the world because of the valuable and sincere services of our corona warriors. He said we are able to check this enemy through community surveillance, issuance of various advisories, cluster containment and dynamic strategy.
Right now, we are quite well placed in the sense that we know our enemy. We also know where our enemy is. And the talk about these hotspots is, I think I must congratulate our surveillance people, our IDSP people, our WHO people, all those who are involved in this and particularly all our state governments, that we have been able to pinpoint where the virus is right now.
Praising India's response to COVID-19, the Regional Director WHO Southeast Asia region, Dr. Poonam Khetrapal Singh said, despite huge and multiple challenges, India has been demonstrating unwavering commitment in its fight against the pandemic. The International Monetary Fund has said that it supports India's proactive decision of imposing a nationwide lockdown in its fight against coronavirus. Chang Yong-ri, the director of the IMF's Asia and Pacific Department, said that the Indian government implemented a nationwide lockdown despite economic slowdown, and IMF supports India's proactive decision. On March 25, India entered a 3-week lockdown, which was slated to end on April 14. The lockdown was extended till May 3. Talking about the impact of coronavirus on economic growth in Asia-Pacific region, he said that there is hope in 2021 if containment policies succeed. Observing that the pandemic is also affecting the financial market functioning, he urged countries to use monetary and macroprudential regulations flexibly to provide ample liquidity, ease financial stress of industries and SMEs.
International Monetary Fund IMF has proposed to deploy its full $1 trillion lending capacity to support countries battling COVID-19 outbreak. Describing the COVID-19 pandemic as a crisis like no other, International Monetary Fund head Kristalina Georgieva on Wednesday said, "The world is now in the worst recession since the Great Depression." Georgieva told reporters at the start of the first ever virtual annual spring meeting of IMF and the World Bank in Washington about its plans to double emergency financial assistance. The IMF board has already approved debt relief of 25 of its poorest members. IMF chief expressed satisfaction that during the G20 finance ministers' discussion, there was unanimous support for the fund to raise more capacity for concessional funding for poor countries.
India has disbursed financial assistance amounting to $3.9 billion to more than 320 million people so far to provide swift, timely and targeted assistance to vulnerable sections in the wake of COVID-19 pandemic. This was informed by Finance Minister Nirmala Sitharaman at the virtual session of the second G20 Finance Ministers and Central Bank Governors meeting. Ms. Sitharaman informed the meeting that the dispersal is being done with a special focus on direct benefit transfer through digital technology so that the exposure of beneficiaries to public places is minimized. She stressed on the role of finance ministers and central bank governors of G20 countries in safeguarding the lives and livelihood of people while maintaining sustainable macroeconomic stability. In her intervention, the finance minister said India is now reaping benefits of the far-sighted measures of financial inclusion which are part of the pioneering reforms carried out by Prime Minister Narendra Modi. Ms. Sitharaman also said that the monetary policy measures undertaken by the government, Reserve Bank of India and other regulators have helped defreeze the market and catalyze credit flows.
A total of 11,933 confirmed cases of novel coronavirus or COVID-19 have been reported in the country so far. Out of these, 1,343 patients have recovered and have been discharged from the hospitals, while 392 patients have died. Briefing media in New Delhi, Health Ministry officials said that the districts of the country have been classified into 3 categories: hotspot districts, non-hotspot districts and green zone districts. The official also informed that so far 170 hotspot districts and 207 non-hotspot districts have been identified.
देश के हर जिले उसको हॉटस्पॉट डिस्ट्रिक्ट्स, नॉन हॉटस्पॉट डिस्ट्रिक्ट्स लेकिन वहां पर केसेस रिपोर्ट हो रहे हैं, और ग्रीन जोन डिस्ट्रिक्ट जहां पर की कोई केसेस नहीं आए हैं उसमें बांटा गया है। हॉटस्पॉट डिस्ट्रिक्ट का मुख्य क्राइटेरिया है वह जिले जहां पर या तो ज्यादा केसेस आ रहे हैं या दूसरे शब्दों में कहें तो डबलिंग रेट ऑफ केसेस वहां पर कम है।
The Home Ministry official said Ministry of Health has also issued detailed directions to states regarding lockdown, which has been extended to 3rd of May.
जितने भी जिला अधिकारी हैं उन सभी को कहा गया है कि जैसे कि मास्क पहनना अनिवार्य है, सोशल डिस्टेंसिंग रखना अनिवार्य है, उनकी अनुपालना सख्ती से होगी। उसका अगर कोई उल्लंघन होता है तो उस पर पेनल्टी जारी की जाएगी। और दूसरी बात ये कही गई है कि जितने भी औद्योगिक या वाणिज्यिक या और भी कार्यस्थल है वहां पे एक स्टैंडर्ड ऑपरेटिंग प्रोटोकॉल जो सोशल डिस्टेंसिंग की दृष्टि से बनाया गया है उसकी अनुपालना होना आवश्यक है।
The Health Ministry official reiterated that there is no community transmission in the country so far. The official said there is no restriction on functioning of any component of the health system during the second phase of lockdown. He said work of MG Narega will be allowed to take place during the lockdown period and proper social distancing norms should be followed. He said this has been done in order to encourage the rural economy. The External Affairs Ministry has said that United States Commission on International Religious Freedom, USCIRF, must stop adding religious color to country's national goal of fighting the COVID-19 pandemic. In a statement, the ministry said that no segregation is being done in civil hospitals on the basis of religion as clarified by the Gujarat government. It also said that USCIRF is spreading misguided reports on the professional medical protocols followed to deal with spread of COVID-19 in India. External Affairs Ministry statement came in response to USCIRF comment wherein it said that it is concerned with reports of Hindu and Muslim patients segregated into separate hospital wards in Gujarat. The government is facilitating the return of foreign nationals presently in India to their countries. These include nationals of Pakistan. Sources said it was understood by the ministry from the High Commission of Pakistan that 180 of their nationals presently in India want to go back. Sources said that the ministry is coordinating with concerned authorities to facilitate their departure.
This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. New set of guidelines released to ease hardships during extended lockdown. Health Minister asks WHO officials to work with Indian counterparts to eradicate COVID-19 menace. Monetary policy measures taken by India helped defreeze market and catalyze credit flows, says Finance Minister Nirmala Sitharaman. Central Board of Direct Taxes issues over 10 lakh refunds worth 4,250 crore rupees in a week. IMF lauds India's proactive decision of imposing nationwide lockdown in its fight against coronavirus. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Central Board of Direct Taxes, CBDT, has issued over 10 lakh refunds worth 4,250 crore rupees in a week. These refunds are over and above the 2 crore 50 lakh refunds already issued in 2019-20 till 31st of last month, totaling to 1,84,000 crore rupees. Last week, CBDT had said that it will issue pending income tax refunds up to 5 lakh rupees to help taxpayers in a COVID-19 pandemic situation. CBDT further said that about 1.75 lakh more refunds are in the process of issuance in this week. These refunds would get credited directly to the taxpayer bank account in 5 to 7 business days from issuance. However, in around 1.74 lakh cases, email responses are awaited from taxpayers. CBDT has appealed that it is in the interest of taxpayers to provide a response to such emails at the earliest so that refunds could be processed and issued at the earliest.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, President of Public Health Foundation of India, Dr. K. Srinath Reddy said that lockdown is a very effective step in slowing down the rate of transmission of COVID-19 infection.
Lockdown measures have been very effective in markedly slowing down the rate of transmission of the virus and reducing the number of potential new cases. They have also been very helpful in providing time for our health and social system to build up outreach and efficiency to handle the problems created by the coronavirus epidemic. It has also built in a great deal of social solidarity across the country.
Talking to AIR News, Dr. B.N. Gangadhar of National Institute of Mental Health and Neurosciences, Bengaluru, advised the people to do exercises and practice yoga to make themselves free from anxiety and stress.
You can do the exercises together with your family members. You can do the yogasanas or meditation together with the family members if you have learned, or if somebody can teach you, a neighbor can demonstrate. Other videos are available today. You can actually do bhajans together.
Participating in the special discussion program on COVID-19 of All India Radio, Dr. Sanjay Pandey of GB Pant Hospital said more testing of the virus have started.
जैसे जैसे कोरोना का आगे का चक्र आगे बढ़ रहा है, टेस्टिंग ज्यादा हो रही है। टेस्टिंग ज्यादा होने की वजह से मामले ज्यादा सामने आ रहे हैं। यह नंबर कोई बहुत ज्यादा ऐसी कोई भयावह स्थिति प्रस्तुत नहीं करता है। पहले 300 मामले आ रहे थे, 400 आ रहे थे, 500 आ रहे थे, अभी 1000 आ रहे हैं। अगर आप इटली, फ्रांस, यूएस से कंपेयर करें तो वहाँ हर दूसरे दिन मामले डबल हो रहे थे। आज 200, कल 400, फिर 800, फिर 1600, फिर 3200। तो उससे अगर हम तुलना करें तो हमारे मामले अभी भी काफी कम है। ऐसी भयावह या बहुत ज्यादा चिंता वाली स्थिति नहीं मानता हूँ।
Dr. Pandey said that there is no need to take medicines for every time you cough.
हर खांसी में कफ सिरप लेने की जरूरत नहीं होती है। कुछ ऐसे मरीज होते हैं जिनको जैसे दमा की शिकायत है, या जैसे कुछ ऐसे मरीज हैं जिन्हें हार्ट की प्रॉब्लम है, या जिन्हें कोई इन्फेक्शन है, उनको दवा की जरूरत होती है। हर खांसी में कफ सिरप की जरूरत नहीं है। यह आप अपने डॉक्टर के सलाह पर निर्भर करता है। कोई भी दवा लेने से पहले डॉक्टर के सलाह के बाद ही लें।
Singer Sudeep Banerjee expressed his feelings about lockdown in this manner.
यूं ही बेसबब ना फिरा करो, कोई शाम घर भी रहा करो। वो गजल की सच्ची किताब है, उसे चुप के पढ़ा करो। सेफ्टी के लिए प्लीज घर पे रहें, कहीं बाहर ना जाएं।
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Dr. Naresh Gupta, senior physician, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone numbers 1-800-115-767. You can also ask questions on telephone numbers 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by hashtag AskAir. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on Air Official. You can also follow us on News on Air app for updates.
There is a silver lining, with statistics showing that the percentage of cured patients from coronavirus is improving day by day. The total confirmed cases of coronavirus infected persons across the country has reached 11,933, with the numbers continuously on the rise. In India, 1,344 patients have been cured so far. More from our correspondent.
On 25th March, when the lockdown was enforced across India, 43 patients were cured, of which was 7% of the total 606 cases. This figure has increased to 11.26%. Health and Family Welfare Ministry data reveals that the highest success rate of 91% has been recorded in the Andaman and Nicobar Island. In Goa, the recovery rate is 71%. Ladakh has 59%, followed by Kerala, which has recorded 54% recovery. In Kerala, 211 patients have been cured so far. Bhupen Singh, AIR News, Delhi.
In Telangana, many women are happy as they receive the first installment of assistance in their Jan Dhan accounts during the lockdown period. Samina, a worker in tailoring industry of Danti village of Medak district, received 500 rupees in both her account and her mother's account. She has already withdrawn a part of the amount for buying medicines for her mother and also for essentials like vegetables.
हमारे दुमती में कर्फ्यू लग रही ना, मैं टेलरिंग पीसेस करती हूँ। हम लोग के गांव में आंध्रा बैंक है, 0 अकाउंट में मोदी 500 रुपए डाल रहे कहते। हम लोग जाके 300 रुपए ले लेके हमारे अम्मी को शुगर की गोलियां लेके घर में को भाजियां और तरकारी लेके, मेरे को भी 0 अकाउंट है बैंक में, कल जाके मैं पैसे लेके आती हूँ।
Another beneficiary expressed satisfaction over transfer of money in her Jan Dhan account.
मेरा नाम है द्रौपदी गौतम। मैं जवाहिर नगर में रहती हूँ। जन धन खाता जो मोदी सरकार का खुला है उसमें मेरा 500 रुपया आता है, उसी में हमारा खर्चा चलता है।
Assam government has got 50,000 imported PPE kits last night from China. Health Minister Hemanta Biswa Sharma and Minister of State for Health Piyush Hazarika received the kits at the Borjhar airport, which have come from Guangzhou in China. Mr. Sharma said that the consignment would reassure the safety of doctors and nurses who are working round the clock against COVID-19. Assam has reported 32 cases so far in the state. Out of them, 2 cured persons have been released from hospital yesterday and kept on 14 days quarantine period. In Gujarat, country's largest coronavirus care facility has been set up in the capital Ahmedabad. The facility, which has been created in the hostel campus of Gujarat University, will ease the load of rising number of patients on government hospitals. A report.
Ahmedabad Municipal Corporation has readied the country's largest COVID-19 care center, which has a capacity to accommodate 2,000 patients. The center is equipped with a library, yoga and indoor game facility for the patients. Ahmedabad Municipal Corporation Commissioner Vijay Nehra said each patient admitted at the center will be provided with separate kits for personal care. He said medical teams will examine the patients twice a day. AMC has also started intensive checking of sanitation workers, homeless and construction laborers to check the spread of coronavirus. Aparna Khoot, AR News, Ahmedabad.
In Ladakh, civil society has joined hands with COVID-19 warriors to defeat the coronavirus. Innovative minds are supporting the administration with low-cost and local-made apparatus in the fight against coronavirus. More from our correspondent.
A 5-set of food-operated hand-washing stand is donated to all the 5 block medical centers of Leh district. The mechanical division, in collaboration with Leh Municipal Committee, has come up with a smart innovation of automated sanitizing tunnel. It is a gate designed to sanitize people as they walk through the gate. This smart gate has been installed at the entrance of SNM Hospital. With Ramesh Chandra, Yangchan Dolma, AR News, Ladakh.
In Uttar Pradesh, the state government is strictly implementing lockdown rules and action is being taken against people violating them. Intensified attention is focused on corona hotspots in the state. More from our Lucknow correspondent.
Total 260 hotspots have been identified in the state where more than 3,83,000 houses have been marked. FIR against 18,571 people have been lodged. 17 people, including 7 women, have been arrested in connection with yesterday's Moradabad incident. 571 people have been booked in black marketing and hoarding. The government is keeping strict vigil on fake news after getting 53 new cases. The total number of corona positive cases have reached 727 in the state. MS Yadav, Yaya News, Lucknow.
Delhi government has extended its list of cluster containment zones to 56 yesterday to contain the spread of COVID-19. Area around G, H and I block of Police Colony in Model Town in the North District of the National Capital was the only new addition to the list of containment zones. There were 8 such zones demarcated a day before. Orders have been given to seal the area under the Operation Shield of the Delhi government.
In Madhya Pradesh, farmers have welcomed the government's decision to buy wheat and mustard on the minimum support price. They say that this decision will benefit farmers a lot during lockdown.
The procurement of wheat on minimum support price under the Rabi season has already been started. Morena Collector Priyanka Das informed that during the procurement full attention is being taken for social distancing.
इस बार जो गेहूं और सरसों की खरीदी है इसमें कोरोना वायरस के महामारी को देखते हुए सोशल डिस्टेंसिंग के लिए सबसे पहला चीज जो किया गया है केंद्रों की संख्या बढ़ाई गई है. इसका आशय यही है कि एक केंद्र पे नंबर ऑफ किसान जो है वो कम रहेंगे.
More than 4,000 procurement centers have been set up in 48 districts for the convenience of the farmers. The state government has already instructed the district collectors to ensure arrangement of masks, sanitizers and soaps for hand washing at all procurement centers. Sanjeev Sharma, AIR News, Bhopal.
In Tamil Nadu, fresh cases of COVID-19 have been the month's second lowest yesterday. The State Health Minister, Dr. C. Vijay Bhaskar, told reporters in Chennai last evening that 38 new cases have been recorded. More from our correspondent.
In Tamil Nadu, the number of new COVID-19 cases yesterday has almost equaled the number of discharged patients. Senior IAS and IPS officials have been deployed by the state government as special officers in all districts to supervise the disease containment activities. Doctors, nurses, paramedical staff and sanitation workers who are at the forefront in the fight against the elusive virus have come in for praise from all quarters. Jai Singh, AAR News, Chennai.
In Himachal Pradesh, 2 more persons tested positive for COVID-19, taking the total number of active coronavirus patients to 18 in the state. A report.
The number of active cases in the state has gone up to 18. Good news is that 12 COVID-19 patients have been recovered. The state government has directed the officers that no leniency would be tolerated while identifying and testing primary and secondary contacts of Tablighi Jamaat. So far, 1,053 Tablighi Jamaatis and their primary contacts identified and quarantined in the state. On the other hand, wearing of masks has been made compulsory in the state, whereas spitting in public places has been made an offence by the state government and its violation will attract stringent action. Sanjeev Sundariyal, AIR News, Shimla.
In Jammu and Kashmir, Department of Food, Civil Supplies and Consumer Affairs issued a rate list for rice and wheat flour and has appealed to consumers not to pay anything extra for the items bought from ration ghats or fair price shops. Meanwhile, with 22 new positive cases of novel coronavirus reported yesterday, the total number of positive cases in Jammu and Kashmir reached 300. More from our Srinagar correspondent.
The spike of yet another 18 positive cases were reported in Kashmir yesterday. There is a good news as well that 6 more COVID patients, 4 from Sikkim Soura and 2 from District Hospital Pulwama were discharged, providing a ray of hope among the people of Kashmir that the infected persons can also recover from the coronavirus pandemic if they strictly adhere to the quarantine norms. This is Sunil Kohl for AR News from Srinagar.
Karnataka Chief Minister B.S. Yediyurappa will inaugurate a mobile testing kiosk for COVID-19 in Bengaluru today. More from our correspondent.
Mr. Ashwath Narayan inaugurated a virtual clinic in a private hospital in Bengaluru yesterday. This clinic, developed by pulmonologist Dr. Chandrasekhar, enables the specialist to converse with the doctor of far-flung hospitals in district through video conference, check the medical records online, hear the pulse and heartbeat of the patient, and suggest remedies. Mr. Ashwath Narayan has said that the government will study the viability of replicating the virtual clinic model in municipal corporation-run COVID-19 dedicated hospitals. Sudhindra, AIR News, Bengaluru.
The Telangana state government has stepped up measures to contain the spread of coronavirus. According to state authorities, 259 containment clusters have been created and special officers have been appointed to ensure strict implementation of the lockdown in these areas. The number of total COVID-19 cases has gone up to 650 in the state. In Bihar, number of positive cases of coronavirus has gone up to 72, with 6 more cases reported. Total number of cured patients have been increased to 37, with discharge of 8 more patients. 1 person of Munger died due to corona last month.
The World Health Organization said on Wednesday it would review its handling of the coronavirus pandemic in due course, following criticism from US President Donald Trump, who froze funding to the UN agency. WHO Chief Tedros Adhanom Ghebreyesus told a virtual press conference in Geneva that areas for improvement would be identified and there would be lessons for all to learn.
And now an overview of today's newspapers covering COVID-19 stories. The conditional easing of curbs on industry by the union government from next week is the top story in most dailies. Government lists curbs to be eased on April 20, headlines in the Sun Times. Statesman headline states rural industrial units to reopen from 20th April. Financial Express report that exports in March have collapsed by 35% and there is more trouble in sight. Health Ministry classifies 170 districts at hotspots. Headlines as Statesman. The Times of India reports 207 more are under close watch. With the nationwide lockdown extended till May 3, migrants in some regions begin to walk once again, reports Hindustan Times. Government expected to roll out plan for stranded labour in a few days is the headline in the Tribune. The Pioneer report that a social worker has been arrested and a news channel reporter booked for fake information causing the Bandra chaos. Amidst the gloom, some positive news about monsoon. IMD predicts 100% normal monsoon, states the headline in the Pioneer.
And now, before we end the special news program on COVID-19, the headlines once again. New set of guidelines released to ease hardships during extended lockdown. Health Minister asks WHO officials to work with Indian counterparts to eradicate COVID-19 menace. Monetary policy measures taken by India helped defreeze market and catalyze credit flow, says Finance Minister Nirmala Sitharaman. Central Board of Direct Taxes issues over 10 lakh refunds worth 4,250 crore rupees in a week. IMF lauds India's proactive decision of imposing nationwide lockdown in its fight against coronavirus. For details of these stories and more, log on to our website www.newsonair.com. With that, we end the special news program on COVID-19.